Hello, Hello, this is Pediatrician Brothers. Welcome back to our channel.
Hello, I'm David. Today we're gonna talk about an important topic, what to observe.
One of the first things that needs to be checked during routine visits is head circumference, especially up to 24 months, because the head growth is very extensive during first 2 years of life.
Upon the measurement, we measure the largest occipital frontal circumference, which we typically do by placing the tape right over the eyebrows at the supraorbital ridge, slightly tilted, so it goes over the largest prominent point of the occiput.
Yeah, and it is pivotal that we document this measurement. A rule of thumbs are that the head circumference grows 2 centimeters every month for the first 3 months of life, and by the end of the year it should have grown by 12 centimeters.
We should be wary of both slow growth and fast growth. Both might be a sign of pathology.
The next thing that we need to check is we need to palpate the sutures and the fontanelles on the infant's head.
Yes, you should remember that the cranium is not a single bone. It is an amalgam of smaller bones such as frontal, parietal, occipital, which are interconnected by sutures.
Yeah, there are metopic, coronal, sagittal, and lambdoid sutures. These sutures have not yet been ossified in infants, and they should not. Hence, upon palpation, we should feel them as well as fontanelles.
Yes, indeed. And if they are ossified in infancy, we might need to refer the patient to the neurosurgeon.
If we talk about fontanelles, let's talk about anterior fontanelle first, which typically is closed between 12 and 24 months in normal situations. Typically, it is very rare that the fontanelle is closed down before 10 months, approximately 3%, and closing after 24 months is also very rare, approximately 11%.
Early closure should always leave the pediatrician alert to check for the other signs of disorders, and especially keep track of head circumference growth, not to overlook microcephaly. Other disorders to be wary of is craniosynostosis, hyperthyroidism, hyperparathyroidism, and hypophosphatasia, although sometimes it can be a normal variation.
Delayed closure also can be a variation of normal. However, it needs to be checked if there are signs of hypothyroidism, primary megalencephaly, increased intracranial pressure, or Down syndrome and rickets.
In case of posterior fontanelle, we typically want it to be closed by 2 months of age. Positional plagiocephaly is not rare in children. However, if there are signs such as ridging of the sutures and the deformation, we might need to take suspicion of craniosynostosis.
Yeah, during positional plagiocephaly, which is benign, typically we see deformation, but the sutures are not closed. In case of metopic closure, we typically see trigonencephaly. In case of sagittal closure, we see scaphocephaly. In case of early closure of lambdoid, we see synostatic posterior plagiocephaly. In case of bicoronal, we see brachycephaly. In case of unicoronal, arterial plagiocephaly.
Yes, and remember that in case of these presentations, it is absolutely pivotal that we involve neurosurgeon and other specialists.
Tummy time is an important activity that is going to help us with positional plagiocephaly.
Remember to play with your child in prone position for at least 30 minutes, and it will assist and help with the development of various muscles, as well as facilitate improvement in the positional plagiocephaly.
We hope you liked the video. Please comment if you are interested in other topics.
And do not forget to like, subscribe, and share it with your friends.